Hello everyone, welcome to Pediatrics by Dr. Anand. This is the most awaited video. This is the last moment revision, top 50 one-liners for your exam, system-wise. So top 10 one-liners on the growth and development. Number 1, what is an infant? So 0 to 1 year of life, that is known as an infant, which is the most commonest cause of neonatal mortality in India. Please remember, the mnemonic is P and B. That is P for prematurity, N for neonatal infections, and B for birth asphyxia. What is the name of the classification for tracheoesophageal fistula? I will repeat again. What is the name of the classification for TEF? What is TEF? Tracheoesophageal fistula. And the name of the classification is Gross classification. Top 10 one-liners on cardiology. Where do you see boot-shaped heart? The answer is tetralogy of Fallot. Where do you see box-shaped heart? Box-shaped heart? The answer is Epstein anomaly. Where do you see figure of 3 and figure of 8 appearance? So figure of 3 appearance you see in coarctation of aorta, and figure of 8 appearance you see in supracardiac TAPVC. Another important one-liners for cardiology. Number 1, which is the most common congenital heart disease in full cardiology? The most common congenital heart disease in full cardiology is a VSD. What is VSD? Ventricular septal defect. Now top 10 one-liners on respiratory system. Number 1, where do you see steeple sign? So steeple sign you see in a case of croup, and where do you see thumb sign? So very importantly, thumb sign you see in a case of acute epiglottitis. Now top one-liners for respiratory. Number 1, what is pneumonia and what is severe pneumonia? Last year PYQ. I'll repeat again. What is pneumonia and what is severe pneumonia? So please remember, fast breathing. Fast breathing with or without chest indrawing is known as pneumonia. If there are danger signs, that is known as severe pneumonia. Let's have some full forms. What is the full form of IMNCI guidelines? I'll repeat again, IMNCI. Yes, the full form is Integrated Management of Neonatal and Childhood Illnesses. What is the full form of BFHI? BFHI is nothing but Baby Friendly Hospital Initiative. I'll repeat again. What is the full form of RBSK? RBSK is Rashtriya Bal Swasthya Karyakram. And what is the full form of ASHA? ASHA is Accredited Social Health Activist. Let's have some important one-liners for infectious disease. If I have a patient, 5-year-old child, came with complaints of rash which started behind the ear, then the face, and then the body, the best answer is measles. Yes. What are the 3 important clinical features for measles? We have CCC. Now what is CCC? Cough, coryza and conjunctivitis. So cough, coryza and conjunctivitis, you should think of measles. Last 5 questions, then this class is over. Which is the most common complication of measles? Yes, so please remember, the most common complication of measles is otitis media, and the most common cause of death in measles is pneumonia. And what is the late complication of measles? The late complication of measles is SSPE. What is SSPE? Subacute sclerosing panencephalitis. Fever with rash. If the patient has a fever today and the rash is coming on day 4, yes, day 4, what will you think of? Fever with rash on day 4, you will think of measles. Day 5, you will think of scrub typhus. Day 6, you will think of dengue. And day 7, what will you think of? The answer is enteric fever. Next important last 3 questions. Where do you see puff of smoke appearance? Yes, puff of smoke appearance. So puff of smoke appearance you see in Moya disease. Kessel's necklace. Last 2 questions. Where do you see Kessel's necklace? Kessel's necklace is because of the problem known as vitamin B3. Vitamin B3 is niacin, and niacin deficiency causes a problem known as pellagra. And what are the 4 Ds of pellagra? That is diarrhea, dementia, dermatitis, death. So these were the important points, top 50 one-liners for your upcoming exam, rapid revision. And please remember, life is beautiful. Keep revising, and everything will make sense by the end of the journey. So please take care and thank you.